So the first law that appeared was in 1996, and this one described all the mandatory procedures for donation, and it regulates the creation of national registry for donors and embryos, and also the number of donations and also the adverse effects. After that, a new law came explaining about the quality, safety for the donation, and also about procurement, testing, processing, preservation, storage, and distribution of human tissues and cells. And this was published in 2006 and also in 2014. And after that, two new European directives were published in 2015, and Spain published a new update on the law in 2017. In July 2015, there was a mandatory registry of annual activity that was regulated by the Spanish Fertility Society. And in 2017, the National Registry of Donors was established, and its main objectives are, first of all, register all the data from the gametes and embryo donation, assuring all the procedures and safety, register the clinic's accreditation, collect clinical outcomes for all the procedures performed, and assure traceability of the cells and tissues. So it says, first of all, that donation will be anonymous and that the confidentiality of donor identity data must be guaranteed by the gamete banks. The identity of the donors may only be disclosed exceptionally in some specific cases and extraordinary circumstances. The children born and the recipients can only obtain general information about the donors that does not involve revealing the identity of the donors. The practice of any of the assisted reproduction techniques, including artificial insemination, may only be carried out in health centers that are authorized for this purpose. Receiving sperm from a sperm bank at home to perform auto-insemination is not permitted by law. Another thing that regulates is that the medical team is responsible for choosing the donor that best suits the phenotypic and immunological characteristics of the recipient. And of course, the recipient cannot choose the donor. And the last important thing is that there is a maximum number of babies born in Spain from each donor of 6, and this is regulated under the National Registry of Donors, whose name is SIRA. And of course, we need to preserve all the clinical data of the donors for at least 30 years in order to be able to track the donors and in case of any adverse effect that we can have. So the donor must sign a contract for the donation with the clinic, which must be free, formal and confidential, of course. Must include the purpose and consequences of the donation, as well as the procedures and studies to which the donor will be subjected. After the evaluation procedure, the responsible doctor must sign an eligibility document in order to be able to be accepted to donate samples. In terms of revocation of the donation can only be revoked when the donor needs the donated gametes for himself. And in terms of safety of the procedures, the sperm bank must routinely inform the competent body of any adverse effect produced as a result of a sperm donation. And a standard operative procedure has to be established to control all release of the samples and its possible uses, of course. So we collect different data, general data of course, like personal data including identification and nationality, occupational history, phenotype including race, height, weight, eyes, skin color, hair texture, blood group and other things, number of previous donations, date and place of them, and for sure the age, because they need to be older than 18 and less than 50. Then we perform clinical exams in order to be able to introduce them in the program. First of all, it's important to do a personal and family history to collect all the clinical data that we can have in order to detect any genetic condition in the family that could exclude them from the program. like having a family history of malformations linked to chromosomal abnormalities or genetic inherited diseases, things like that. Then, of course, we need to do a complete psychological evaluation and a complete physical evaluation. The sperm sample has to be done and has to be normosospermic, following the World Health Organization parameters. And what we test in blood is, as I said, the blood type and some infectious diseases as well, like syphilis, hepatitis B and C, HIV, CMV, papillomavirus or herpes, toxoplasma, chlamydia, trachomatis, for example. And the law also states that an evaluation of the genetic load in relation to the existence of autosomal recessive genes will be carried out according to scientific knowledge and the known prevalence in the donor's ethnicity. It's a little bit ambiguous, and what most of the centers are performing is a karyotype in order to detect any chromosome abnormality, and a comprehensive genetic panel of recessive diseases that includes the most prevalent inherited diseases. This varies a lot between banks. Some of them they test only 10, other ones test more than 500 diseases. The important thing here, the important part, is to correctly inform the recipients about all this. So we need to inform that almost all people are carriers of some genetic disease, that there are tests on the market that can analyze a limited number of diseases, so probably not all of them. We know that not all of the diseases could be tested. And it's also important to properly inform about the genetic test carried out on the sperm donor and give them the possibility of performing a genetic matching.